Moving on now, as the COVID-19 pandemic strains the availability of essential healthcare services across the world, midwives are on the front line saving lives. Behind the masks in many health centers, hospitals and homes, we can see the faces of hundreds of midwives working tirelessly to prevent maternal deaths and deliver babies safely. Here is our reporter, Benard Yiga, with more details.
For centuries and through pandemics, midwives maintain presence to attend to strained environments. Even after the deadly COVID-19 pandemic hit the world, the role of midwives is visible. On 5th April 2020, at Entebbe Grade B Hospital in Wakiso District, an expectant mother tested positive for COVID-19, but delivered a child successfully through cesarean section.
Everyone would think me going in this kind of operation just puts me at a very high risk. But what gave us the confidence was the preparations. We prepared well. We made sure we put on proper protective gears. And this is what calmed down the kind of fear. But for real, we're a bit of skeptical at first.
When we're going in, we made sure we were dressed on well and protected ourselves. So just know that when we're inside, everything that we're doing it very fast. Make sure that we don't expose ourselves to the virus. Even
after a successful operation, it was important to ensure the baby is not infected.
We were telling her to always put on her mask while breastfeeding her baby. Then not forget washing her hands. So we emphasize so that she can minimize the spread of COVID-19 to her baby.
At the same hospital on July 5th, a traveler from Dubai who had been under quarantine delivered a baby boy by an emergency cesarean section.
Because of the previous experiences, it was a matter of just calling back the team and say, now this is the second kind of operation. What can we do? And through our team leader, we really organized back the team, assigned the roles.
So we entered in confidently, worked on our mother. Baby came out very well, and both mother and the baby were all in good condition, and up to now they are very okay.
These were rare cases handled by a team of experienced health workers that included midwives, physicians, and epidemiologists. The two incidents have built confidence among doctors and midwives,
as well as experience, which can't just be taken away like that. So after realizing that we tested even negative following such a kind of sacrifice, we became actually more stronger and confident that if we obey and follow the guidelines plus the standard operating procedures, we can do this very well and successfully.
First of all, I'm a senior midwife, so delivering mothers it's not difficult for me. I would say that the only unique thing with COVID-19 is that you have to protect yourself, yeah? But everything remains the same. Yeah, that's all. So I would say with infection prevention, I'm now a class.
The director in Entebbe Regional Referral Hospital, Dr. Moses Muwanga, says COVID-19 scare led to a reduction of mothers delivering here.
Many other services, including the maternity and reproductive services, scaled down. We initially were handling between 300 400 mothers we are attending in Entebbe Hospital for antenatal services every day, and we would have between 600 700 mothers deliver into the hospital per month. 10% of those were cesarean section referred from other facilities. So ideally, after COVID coming on board, all these services scaled down, totally stopped within the hospital.
For now, mothers will find other health facilities to deliver in.
We have supported these facilities like Katabi, Chigungu, with drugs to help them handle the number of mothers who are supposed to attend Entebbe Hospital. We have also seconded some staffs into these facilities, attached them there So COVID somehow affected these mothers, whereby an extra distance has to be moved by these mothers to attend their facilities.
The ministry is also equipping all regional referral and general hospitals to handle COVID-19 cases. Minister for Health Dr. General Thacheng reported a reduction in maternity and delivery services due to COVID-19.
Antenatal care for attendance decreased by 7% between March to April 2020 compared with the same period in 2019. This mostly affected the northern and southwestern regions of the country. Health facility deliveries have decreased by 10% between March and April 2020 compared to the same period in 2019.
In Masaka, the in charge of maternity ward at the hospital, Beatrice Mande, admits that COVID-19 caused fear.
We fear because you don't know whom you are dealing with, where they come from, who their contacts are. But in the other hand, the professional hand, you have to do the work without fear because we took an oath. We have to serve them. Our happiness is to see a live mother and a healthy baby alive, both of them alive. Maternity department, we have really been operating. And we're operating. We don't have any regret because we love really our job. And we have really many deliveries during this season.
In Masindi, an expectant mother of 2 was affected by coronavirus.
I've got a challenge whereby we find it difficult coming for antenatal.
Masindi Hospital Administrator Simon Baguma cites transport challenges.
And sometimes you find a list of calls when mothers are there in the villages waiting for one ambulance.
In Gulu, Acholi sub-region, the pandemic led to a reduction in the number of mothers delivering in health facilities, resulting to traditional birth attendants. Dr. Kido Christine, the in charge of maternity ward at Gulu Regional Referral Hospital, says this led to loss of lives.
When 2 mothers were brought in an ambulance, and it was like manslaughter in that ambulance, because one was pouring blood like water in the tap, and one was already in the late stage of labor, and the baby in the womb is already not alive. So in that scenario, pain almost each and every one here, including even the gynecologists which we have here, because we wanted to save the life. But what came, it was not what we expected now. So what we did, one came, there were 3. One came with retained placenta and was also having the PPH. The blood was also pouring like water in the tap. But we saved the life of those mothers, but their babies, we could not do it anymore.
Dr. Christine put the blame on transport challenges.
They were willing to bring, but there's no transport to bring this mother here. So the time she came, it was already too late for the baby, but it was early for the mother.
Even after easing restrictions on public transport, the director of Gulu Regional Referral Hospital, Dr. James Elima, says some mothers fear attending antenatal due to COVID-19 at a facility.
And we keep on encouraging them that the 2 centers are totally different and totally isolated. They are not mixed up. And we are very vigilant indeed amongst also our triaging system, so that we do not mix up cases which are suspect with our mothers.
State Minister for Primary Health Care, Dr. Joyce Moriku Kaduchu, says maternity services have improved.
At the beginning of lockdown, that was way back in March, you realize the services had gone down. Many mothers were not able to access the services despite the fact that transport for pregnant mothers and other people have been left open. But along the way, you realize that these services have improved. As you go to any healthcare center, any health facility, mothers are able to access antenatal services, immunization services, deliveries, postnatal care.
Entebbe Hospital is opening up a maternity ward, targeting returnees.
Because the 3 phases we have had, on this fourth phase of people returning from Dubai and other abroad countries, many are returning when they are pregnant and they have been referred to Entebbe Hospital. So we are opening up the maternity section to start handling these returnees. So far we have over 14 mothers who have returned pregnant. We have had so far 2 cesarean section of these returnees. Many of our sister hospitals fear to handle COVID suspects or confirmed cases of mothers. As a hospital, we have handled them. We're also training a team of gynecologists, pediatricians, anesthesiologists to handle especially these cases of COVID, which I think will be something good as a hospital to ensure that all the mothers who are in various quarantine centers who are COVID, either COVID positive or COVID contacts or suspects can be handled in Entebbe.
The 2016 Uganda Health and Demographic Survey shows that 7 out of 10 women deliver with assistance from a skilled birth attendant. Studies also show that when supported by a functional health system, midwives can avert 87% of all maternal and newborn deaths.
We thought we were going to lose very many mothers during this COVID period, but to our surprise, the maternal mortality has not been really too much as expected. That is because of the work of the midwives. We want to thank them and we encourage them. Let's continue to work to save the lives of the mothers, and also you need to take care personally as a midwife.
Benard Yiga, UBC News.
Midwives doing what they do best, and that is to make sure that they deliver babies safely, but also make sure that the mothers are also safe. Thank you so much, Benard Yiga, for that elaborate story there.